Hello and welcome back to The Path, the podcast from Lifestyle RX. Happy to have you here again today. Today I'm joined as always by Dr. Brendan Byrne. How are you doing today?
Hey, Dan. A little wet today.
And also this week we have a special guest, Sara Gilbert, the CEO of Live Well Exercise Clinics. So I think I'll just turn it over to Sara to maybe introduce yourself and tell us a little bit about Live Well.
Yeah, thanks so much for having me on today. I think that it's so incredibly important for us to have the discussion around, how do we get involved in exercise, specifically for health benefit? And that's exactly the reason how Live Well Exercise Clinic came to be. I actually did my degree in exercise science, and then I did a postgrad in something called clinical exercise physiology. And I did that through the American College of Sports Medicine. And with that type of a designation, I was a great candidate to work in something called cardiac rehab. Now, many of us have probably heard of cardiac rehab, exercising people after usually any type of heart intervention, whether it be stents or bypass surgery or an MI, exercising people for about 12 weeks. But typically in a hospital led by healthcare professionals, and really helping people to exercise in order to gain enough of a health benefit that they can go back to their performing their daily activities. And in my decade-long career in working in cardiac rehab, there was a few key things that I heard from our patients with heart disease. And one of the key things was, can my wife, brother, neighbor, colleague, friend, can they participate in cardiac rehab because, they've just been told they have prediabetes or diabetes or, arthritis or, they're managing depression, and they would really benefit from this kind of healthcare-led focus to exercise. And unfortunately, at that time, my answer was always no. And unfortunately, they have to have had some type of coronary event, but that's really what led me into 12 years ago in 2011. I actually quit my job, cashed in my pension, and started Live Well Exercise Clinic, really with the mindset that I wanted to expand the people who could benefit from healthcare-led exercise, from being in a safe and supported environment where we know that our health and our health benefits are really at the center of the discussion and our programming. And that once our health improves, we have a better quality of life and we can live life to the fullest. And that's really how the very first Live Well Exercise Clinic was born.
So Sara, that's awesome. And it's funny because one of the programs that we ran in our clinic, it was a weight related program, and we honestly had people gain weight to get into the program. But I don't imagine you had anyone give themselves a heart attack. So
no.
So this so the group of patients that you work with tend to be people with some kind of chronic health issue, which as we get older, we all kind of fall into that category eventually almost.
Yeah.
And you're able to kind of program for them specifically. So in the 4+2 diabetes reversal strategy, number 2 is kind of the role of muscle, and muscle, we call it our metabolic engine. It's our carbohydrate buffer. When people are trying to reverse insulin resistance, it's getting the muscle to be efficient at burning fat, which obviously it does in the aerobic zone. We tend to get people started, and often people come to our program and they really haven't been doing much. And we tend to get people started by focusing on frequency first. So we actually want them to do something every day. The key, as I always say, is that something can be really small, and generally aerobic. We'll just start kind of get them out walking. We're not worried about intensity. Next, we build the duration, try to get them to half an hour a day, up to 45 minutes a day or beyond. And then finally, we start talking about intensity. Usually, it kind of gets kicked off in week 11 of the 12-week program, because by that point, they've got a couple of months under their belt of frequency and duration. And we start to talk about resistance exercise as one of the ways of driving intensity. So you have somebody who is in week 11 from our program. They went from 0 minutes a week to 150 to 300 minutes a week of walking and good aerobic exercise. Where do you start with that person? How do you approach that person, and how do you take them up to the next level?
Yeah, and I think that, the way that your program creates that foundation for people is so incredibly important and incredibly successful, because really it is about this healthy habit formation, and how do we slowly start to introduce more movement. And the only way that we can do that is really by committing to something on a regular basis. And as we start to get to, once we do have the frequency and once we do play with duration, we only have 7 days in the week and we only have 24 hours in the day. So both of those things max out, and we're only going to be active, 150 to 300 minutes is really where we would love to see all Canadians, right? But once we've maxed out on the minutes and the frequency, the only thing we have left is intensity, right? And the principles of exercise science, and in continuing to gain benefit and in continuing to progress, is about making sure that we're always changing things, right? And so intensity is this really, really important conversation, and resistance training introduces that. Resistance training is this incredibly under-recognized and sometimes simplified method of us exercising. Because yes, it can do things like, as we get stronger, we can improve our balance. As we get stronger, we can, lift things up onto the counter, or carry the grocery bags, or maybe even walk up the stairs better using some of our cardiorespiratory fitness and some of our strength. But as we actually build muscle, we actually manage our blood sugars better. And we see this consistently in our members who have diabetes, who are coming and exercising with us. Many people will say, I've been walking and I can get that frequency in. And, that's barring sometimes good weather. But when we get that frequency in, we really have to ensure that we're getting about 8 exercises of resistance training in. And with that resistance training, we have to understand where we're starting and where we're going. And so we have to kind of look at even just our posture and our functional movements, because as we're building muscle, we want to make sure that we're building the right muscles, we're stretching the right muscles, that we're putting emphasis on, and all of our bodies are different, right? So as we approach resistance training at LiveWell, we put all of our members through 8-week cycles. And in those 8-week cycles, we have a specific focus that we're trying to really have the muscles works, maybe for stamina and endurance. Maybe it's for hypertrophy, actually growing the muscle. Maybe it's a little bit more about power, but we need all of these phases in order to kind of, put together our full physical fitness and our full physical health. In some ways, it's like, when we build a house, we have all of these different rooms and they all have a different function, but together they make a home. That's the way we can look at resistance training, right? Resistance training is all of these different rooms in our physical fitness and health house. But together they really make a home layered on top of frequency and duration.
Yeah. Yeah, it's fascinating when you look at the muscle physiology there. So one of the things that happens in type 2 diabetes is people's mitochondria don't work very well, and they don't have as many mitochondria. And with the aerobic exercise, we certainly see you can increase the mitochondria, but resistance, you can also increase mitochondria. And in fact, it's a different mechanism. So yeah, there's multiple ways to come at this. So when you look at those different rooms, and you largely program across these 8-week cycles with kind of one specific goal, is that something that you evaluate? Is it something that the patient themselves, the member themselves says, gee, I really want to, get stronger? How do you figure out kind of what to do with that 8-week cycle?
Yeah, so, there is, again, a science behind this about what we need to do first. So, for example, the very first phase that we're going to put all of our new members through, anyone who are introducing to resistance training, is a high repetition phase. And in a high repetition phase, we're actually increasing capillarization in the muscle. So we're increasing all those blood pathways. And when we do that, we're not only preparing the muscle for things like more strength, more stamina, and so forth, bringing nutrition and recovery to the muscle. But we're also making a profound impact on hypertension, blood sugar management, because we've created all of these new pathways. So it is about a process, like when you're building a house, you don't kind of put all the plumbing in before the walls are built. You wait till the frame is up and then you start to kind of drill the holes to put the plumbing in. The exact same process we follow with resistance training, and our goals that are individual. For maybe it's that somebody wants to be able to go on that dream holiday where there's going to be quite a bit of walking and they're going to maybe have, stairs to climb at many different times. Maybe that's a life goal of theirs. We can absolutely use the resistance training to layer those 8 weeks on top of each other to achieve that personal goal. But we're following the principles of science, making sure that we're starting with increased capillarization. Then we want to build on endurance, right? Then we want to build on the size of the muscle, and then really going into strength, finishing with some power, making sure that in there we've had some times of active recovery, to really allow the muscle to do the best job physiologically for our health and for the management of our diabetes, but also help us achieve what our life goals are.
Nice. And so tell me a little bit about when people are starting, what's probably the most common piece of advice that you have to give somebody that's starting with you?
Yeah, I think it's really about commitment and being committed to something, and to that it's hard for everybody to stay committed, and there's going to be times when it's easy and it's going to be times when it's really challenging to show up, and that showing up is the most important thing. There's whether it be seasons of the year, whether it be just seasons in our life that make it more difficult to be regular at exercise, that really having that accountability is incredibly important, and to have that structure where change is constant, because our body needs to have that constant change, specifically when it comes to resistance training. And most people come to us again saying that, hey, maybe they haven't been doing any walking. But for many people, they say, I do some walking, whether it's 50, 100, 150, 300 minutes a week. But it's about really then starting to build our repertoire of resistance training. But really, that has a lot of expertise behind that. And so that's really where working with a healthcare exercise professional is so important in making sure that we're doing the exact right thing to get the exact right benefit that we're looking for.
So when somebody comes to you, let's walk through kind of what the experience is like for a member to come into a Live Well clinic, because I think it must be because you're talking to me. We're jumping right into physiology, and I'm going to mitochondria, but that's not really why people kind of come through your door. Let's talk about the experience of kind of what it's like to do a Live Well class. Because I think as you're saying that commitment, I was thinking, a lot of people kind of have struggles to, stick with resistance workouts because they're kind of boring on their own, or they don't know what they're doing, or all of the above.
Yeah, exactly. So all of our members attend in our clinics twice a week for 1 hour sessions. And those are on regular days and times for our members' benefit, so they can have it in their calendar as an appointment. That helps us with the accountability. All of those sessions are supervised by our clinical exercise physiologist or our registered kinesiologists, so that our members are safe and supported in their exercise. So every single session, we're right there with our members, helping and adjusting their exercises as needed. In our clinic setting, we have anywhere from up to 10 to 12 members maximum in about 1,200 square feet. And this provides our members with a small group environment, but a highly customized program. So it's kind of the best of both worlds, right? It's that community and that socialization, which many people come to us because they're saying, hey, I need to add resistance training into my workout. I need to increase my intensity. I'm not really sure how to do it. But why people stay at Live Well is because they actually make friends of all people who are there for a very common reason, which is we're all here to improve our health. And then we start all of our members with a baseline assessment. And that's a 1-hour appointment where we are actually going to dive into your medical history. We want to understand what medications you're taking. We're going to look at your posture, and we're going to analyze your posture and how your body is just standing when you're just standing in a neutral position. We're also going to look at some of your main functional movements, even just sitting and standing from a chair. And we're going to measure those so that we understand where you're at today, so that we can make the most highly customized exercise program. And from there, again, our members are attending these 2 1-hour sessions, and they can attend more if they want and add in additional sessions, but 2 is our absolute minimum. And why? And that's just because we can really then ensure that people are getting in that minimum requirement of exercise. And then people don't really have to worry about it. They can add in more if they want, right? But one of the really neat things that our members appreciate so much about Live Well is that as experts, we are prescribing the exercises that we feel would be best given the information that we have about each of our members. But it's a two-way street. So we also ask our members to rate how hard the exercise is for them every single day that they're in the clinic, providing us with that feedback to say, hey, this exercise, maybe today this exercise is harder than usual. And then that can help us to understand. And then we learn, oh, you spent the weekend gardening, you're a little bit more sore today, and that's why these exercises are more challenging. But typically it's that we want to make sure that the intensity is exactly where we want it to be. And with that constant feedback loop of us prescribing exercises, being the experts in exercise, and our members being the experts in their bodies and providing back to us how hard that exercise is for them, we get this really perfect mix of a highly customized program that is really driving this person forward for health benefit, health outcome, and ultimately to live life to the fullest, which is really why all of us want our health to be in an optimal state, right?
Yeah, and as I was going to ask you about the kind of the role of the exercise professional, but I think you really described it so well there, just in in terms of that two-way communication, and from the professional being able to observe, but also from you being able to communicate maybe some things that don't sound so important to you. I'm just sore. Where are you sore?
Yeah.
What about injuries? So often people will have, well, as we get older, we often carry around some chronic injuries. But what about injuries, acute injuries, chronic injuries, and then maybe we should talk a little bit about, arthritis. So let's just do the first two, acute injuries and chronic injuries. What's your approach there?
Yeah. So, this is a constant for us. We're always having members who have acute and chronic injury. And it's about us, again, really evaluating and understanding, how that injury happened, how that injury feels today, what type of treatment that injury has had, specifically if we're talking about chronic injury, and then creating an exercise program around how we strengthen that. Oftentimes, when we have an injury, our number one thing is to avoid and compensate, right? And this puts us in a more difficult and actually dangerous situation with our body. And so we actually want to kind of understand exactly where that is, and we want to start to build the weakness around that. That's when we talk about acute injury, that also just requires sometimes modification and creativity. Again, I would say that most people with acute injury means we immediately become sedentary, right? So if we have, I'm going to use the example of a sprained ankle, right? We recently had a member that was out playing pickleball, which is a great way for people to be active. But sometimes our minds move ahead of our bodies. And so we can get some, sprained ankles and that sometimes. So a member comes to us and they have a sprained ankle. And they want to stop exercising because they've sprained their ankle. But I think that what our expertise has to provide is, how do we modify your exercise program so that the sprained ankle can have the recovery and rest that it needs? I'm not suggesting we exercise a sprained ankle, but we can modify all of the exercises so that you're not giving up on anything else, right? And that we have the exercise equipment so that people can actually even keep up their cardiorespiratory fitness. They may not be able to walk, but there's other things that we can do. And we can do our exercises seated if that's necessary and still get equal benefit, so that as that recovers, we haven't all of a sudden seen diminishing returns from all of the resistance training that we have been doing.
Yeah, and that's such music to my ears, because one of the things that I see with people, and we've all been there, is we get an injury and we stop everything. I can't do this because my ankle is sprung.
Yeah,
it doesn't really affect your core or your arms or your other part of your leg. It's just the ankle. And so why should we give up on those benefits?
Exactly.
So that's awesome. And I think I think you touched on this a little bit, but maybe just emphasize the confidence that somebody gets from knowing that there's actually somebody who knows what they're doing giving them advice, right? Versus just some guy at the gym who told me that I could do this, right?
Yeah, and I think that rapport and trust piece is crucial, and it's probably at the forefront of the importance that our members have in Live Well, is really working with a healthcare professional that they know has their interest in mind, and that we, because we work with our members twice a week for an hour, you can understand that type of relationship and trust that does build. And when we are able to, identify a member who maybe did, spend the weekend in the garden and is sore, and we can say, hey, let's just tweak your exercises today this way so that you feel good doing them and you can complete them. Then we also start to gain the trust that when an injury does happen, hey, let's tweak your exercises. So again, change is the constant. And when we can trust the change and we know the change is in our best interest, that only builds our confidence, not only to exercise at Live Well, but for our members to exercise on all days of the week in their own life.
Yeah. So what about arthritis? A lot of our members have arthritis in their knees or hips that limit them in terms of what they can do.
Mm-hmm.
How do you approach somebody with, let's start with somebody with severe arthritis where walking's even a challenge, and maybe they're on a replacement list.
Mm-hmm. One of the neat things actually that we do at Live Well is every single session we provide a little bit of health education. And just last week we were talking about this. And one lady said, I know that I'm going to wake up every day and I'm probably going to have discomfort and pain, but I know that if I didn't exercise, I'd have more discomfort and more pain. And I think that that's some of the foundation that we have to really be thinking about when we really look at like osteoarthritis and exercise, is that exercise isn't necessarily going to create pain-free motion. But motion is lotion. And it's incredibly important that we overcome our psychology of, I need to do nothing and protect the joint. And as I do nothing, is that joint actually getting better? In most cases, it's not. We're having more limitations, more discomfort, more pain. But when we exercise, we may still have some discomfort. And I kind of, often we'll use the analogy of when we start exercising with osteoarthritis, our joint is a little bit like a rebellious teenager, and it's maybe going to scream and kick as we start to do these things with it. But eventually, after about 6 weeks, things start to calm down and the joint starts to say, thank you, I love you. Thank you for doing all of those things. And so our members really do experience that. But it's not we have to understand the expectation that exercise isn't going to create a pathway of pain-free movement, but let's think beyond that joint, right? So we have to be moving our body so that we're strengthening all of the muscles of our body, so that we're improving our physiology, reducing our risk for heart disease, improving our diabetes management, and all of those things far outweigh the discomfort that comes with osteoarthritis. But we do know that by strengthening the muscles that surround the joint and by getting that joint moving, we are in most cases able to improve the symptoms of osteoarthritis.
Yeah, the study that always impressed me the most was out of Denmark, when kind of some targeted neuromuscular exercises for knee and hip, and really kind of what they're doing is strengthening the muscles around the joint, and especially the secondary muscles around the joint. And they actually did a controlled trial where they randomized into people that got their surgery and then did the exercises post-surgery, and people who did their exercises pre-surgery, and then they were to be evaluated at the same time. And what was amazing was the people who had surgery definitely had less pain than, in the long run, than the people who didn't have surgery. But 75% of the people who did the exercises first actually declined the surgery, because pain improved, but their function improved so much that they just couldn't imagine going through a surgery when they could do all the things they could do. They didn't want to do that. So I think that's again something that if you can work with somebody, an exercise professional you can share that feedback of how the joint's feeling, you can get the confidence that you're not pushing too far, and that you're pushing just enough to get that benefit.
Mm-hmm.
So one of the things that a lot of people will come to us with is, they'll read the articles around 6-minute workouts and high intensity interval training. And for many of the people kind of coming in our program, that's an intensity level that, they haven't done for a long time. And we generally try to discourage that, because we want to build the aerobic base first. How do you play with the higher intensity interval training? Is that something that you guys do? What role do you see for that kind of in the fitness pyramid?
Yeah. So definitely, as somebody progresses and first goes through all of the fundamental stages. So we want to go through all of those preliminary stages with the muscles. And then it's also about personal preference, right? So exercise is something that we also want to enjoy, and we have so many options, and we have full creativity over how to personalize a plan for somebody, that we do want to meet personal preferences. And so if somebody is really keen on doing some type of interval training, again, we have to remember that interval training and high intensity interval training is just a higher intensity than you were originally working at. It doesn't mean sprinting on the track when you've been, barely walking or something. It means slightly increasing that intensity from what it was before. But that's really up to the individual if that's something that they would want to introduce. Saying that, by the time we get to the point where we're having the discussion of those options, somebody has a really strong foundation. So that whole house is already built before we're hosting the biggest New Year's party of the year type of thing, right? So that whole house is built. We have the foundation. We know that it's operating well, that there's no issues. But those are definitely some things we can introduce. I think that the key part of any exercise program, again, is about feedback and making sure that we are creating longevity. And my biggest concern when people want to increase intensity too quickly before they've looked at frequency and duration is injury. And the number one reason why people start exercise and stop is that they did too much too soon, and their body had difficulty keeping up. And so they stopped and thought, I just need this to get better. And once this gets better, I'll get right back into my plan. And we all know what happens. Procrastination, seasons pass, time passes, and we don't get back into it as quickly as we had hoped. And sometimes months and years pass before we reintroduce ourselves to it. And oftentimes what we see is it's taken someone's seen such a detrimental decline in their health that they've really been forced to come back and try exercise again. So I think that we really have to weigh both of those. But again, frequency, duration, and then intensity is the right way to go, and to have that highly personalized to that individual's needs.
Yeah, so we're definitely singing from the same choir book there, because that's exactly what I see. And when I talk to people and take their history, we'll often kind of hear kind of a whole number of false starts with exercise, and often it is that too much too soon, get injured, or it feels so horrible doing it that you just don't want to do it.
Yeah.
And slow and steady. One of the things that kind of want to make a point for everyone listening is, often when they go through our program, in the 12 weeks, you'll often master the nutritional principles. And by and large, those will continue to obviously benefit you, but you don't get anywhere near the compounding you get from exercise, right? So exercise, you truly can progress. So it's not just that you're kind of doing, the 150 minutes of exercise. It's just that 150 minutes of exercise you can actually make real progression with that and get fitter and stronger and be able to do things you weren't able to do. It's kind of the one way we can turn back the clock, isn't it? Right. When we look at how we feel in our lives. And the other thing that I kind of look at from the science of it is, we tend to think of our muscles and, as just these kind of, they're just kind of, working engines to move us around. But they send a whole bunch of messages to our body. Right. And, one of the messages they send that's really interesting is they actually send messages to our pancreas, to our beta cells. And so obviously in type 2 diabetes, the reason the blood sugars go up is that the beta cells can't compensate anymore for the insulin resistance. The signal from the muscle may actually improve the health of the pancreas beta cell in a way that nothing else can. So it is kind of, you want to just keep kind of growing that compound interest and putting in little deposits every week of, twice a week going and doing that workout and then, doing the aerobic exercise on the other days. What about the concept of exercise snacks? Anything you can say about those?
Well, first of all, when we're not exercising at all and we're just focusing on kind of frequency and then getting a little bit into duration, of course, going from 0 minutes to 10 minutes of activity or 6 minutes activity, it is a significant difference. And we will see some health benefit from it. And I remember back when I was leading a cardiac rehab group, and some research came out on heart failure, and it was saying how, heart failure patients, they could exercise for 10 minutes a day, and it would really, manage their risk of going into heart failure again. And, our cardiac rehab patients were like, well, why are we here for an hour? We can go after 10 minutes. I've done my 10 minutes. I'm out of here. But what we have to really look at is that those are people who were doing 0 minutes. And so exercise snacks or small durations of exercise we really have to keep in mind where we are. So we don't want to go back. We don't want to reduce the frequency and the duration. But it is important for us to sit less and to move more. So if we do have opportunities in our day to additionally, on top of a full bout of exercise, to maybe that means it's a little bit of an exercise snack. Maybe it's a walk around the block after dinner. And it doesn't have to be a 30, 45 minute, moderate to vigorous intensity workout. But it can just be a little bit. All we're trying to do is encourage people to move more and to sit less. And that's really where I would focus on that.
Yeah. Nice. Maybe you can tell everybody, if they're interested in working with the Live Well clinics, maybe tell a little bit about where you guys are and how to find you and how to go about that.
Yeah. So we have locations in BC, Alberta, and Ontario. They can all be found on our website, livewellclinic.ca. And what we offer to every person is to come in, book in for a free session. You're going to spend an hour with us. We're going to welcome you as our guest. We're going to, give you the experience of what it would be like to be a member. We are going to teach you some highly customized exercises that day, and really just give you a taste and an experience for, what it feels like to be in Live Well. Because what we hear from our members is that the environment and the support and the accountability and the programming, it's really hard to explain, but people just have to come and experience it. So we give that experience away, just that first session for free. So you can come in, and I'm highly confident that it's an integral part of your healthcare. But we want everyone to be just as confident, and you'll see that when you come into our clinic. So we invite anyone who would like to come and participate can just go to our website, again, livewellclinic.ca, and book themselves in at any of our clinics across Canada for 1 hour free session.
Now, I need to close with this because I was just driving by your clinic an hour ago. And
Okay.
tell everybody what the little colored circles are on the wall.
Oh, yeah. So one of the things that we did 12 years ago when we started at LiveWell was our members started to come in and really, as they were building their self-efficacy and their pride in how they were proud of themselves for accomplishing exercise in a way that they had never before. Our members talk about sticking with exercise or, doing exercises or doing things in their life that they could never do before. And we thought, instead of just talking about these things, let's write them on these win circles. And these win circles accumulate and become the wallpaper inside our clinics. They're highly colorful. They're all different colors. And our members will choose a color. And the win that day might be, I showed up. And maybe that was an extremely difficult day to just get there. And sometimes it's about what their A1C is, and they're very proud of that. Sometimes it's about how many sessions they've, completed 150, 650, 900 sessions. And they're incredibly proud of that. Sometimes it's that, they were able to stand and hold their grandchild for the first time and feel confident and strong enough that they could do that, or they could get down on the floor and play with their grandchildren. Any of those things that are meaningful to our members, we put on those circles on the wall. And literally our clinic is adorned with the pride and accomplishment of our members. And so I always say to people, if you ever need encouragement, all you have to come and do is walk into a LiveWell and read our walls.
That's so awesome. Yeah, I love that. We have something similar on our online community. We have a kind of share your win where people will share their wins. And one of the ones that was shared just this last week, and I'm going to repeat it here because I think it's just so inspiring. One of our patients wrote, she's 72. She completed the program last spring. She's now off all medications after 18 years. And she's 50 pounds lighter than a year and a half ago. She walks 10,000 steps a day, strength training 3 times a week. And then she said, this has all been good, but my real big win was I was able to do 117 kilometer from Sarria to Santiago. So the Camino in Spain, she did that in 9 days. So not only first Camino, it was our first trip to Europe. So I think that's kind of, the type of transformation that people can see. It's just so inspiring. And I think it's just, it's inspiring for everybody. Yeah. I know one of the reasons why so many physicians want to work with us is actually, it's kind of, it takes your breath away to hear somebody say that, somebody's on medication for 18 years. And it's the role of getting, stronger and fitter and progressing that to the place where you can walk 117 kilometers in 9 days is awesome. So, well, thanks so much, Sara, for joining us.
Yeah, thank you.
And Dan, I've dominated all the questions just because I love to promote exercise.
Oh, good. I'll do. So thank you so much, Sara, for joining us, and thanks, Brendan, for looking after all the questions today. I'm glad that you were able to have such a good discussion. This was awesome. So, and again, if you're interested in joining the Lifestyle RX program, it's available in BC, Alberta, and Ontario. It's covered by provincial health benefits, and you can sign up at lifestylерx.ca. And if you know of anyone else who'd like to hear this podcast, you think will benefit from it, feel free to share it with them, and we'd be happy to have them as a listener. So, thanks to both of you for being here again, and we'll talk to you all again soon.
Thanks, Dan.
Thanks.
Bye.
Thanks, everyone.